Have you ever gone to the bathroom during your period, looked at your pad or tampon, and suddenly thought, wait, is my period supposed to be that color? Maybe it was bright red, maybe dark brown, maybe it looked almost black, or perhaps it was pink, orange, or even gray. If you've ever wondered whether your period blood color is normal, you're definitely not alone. But here's something most people don't know. Your period blood isn't always supposed to be bright red. In fact, different colors can tell you a surprising amount about what's happening inside your body. Some are completely normal, while others may be your body's way of asking for medical attention. So in this video, we're going to decode every color, from bright red to gray. And by the end, you'll know exactly what's normal, what's not, and when it's time to see a doctor. Why does period blood change color? Before we talk about the colors, let's understand one simple concept. The biggest reason period blood changes color is something called oxidation. Now, don't let the word scare you. Think about an apple. The moment you cut it open, it's fresh and light in color. But leave it sitting for a while, and it slowly turns brown because it reacts with oxygen in the air. Blood behaves in a very similar way. When menstrual blood leaves your body quickly, it stays bright red, because it hasn't been exposed to oxygen for very long. But when the flow is slower, the blood remains inside the uterus or vagina longer, giving oxygen more time to react with it. As a result, the color gradually changes from bright red to dark red, then brown, and sometimes even black. So most of the time, the color simply tells you how old the blood is, not whether something is wrong. Now let's go through each color one by one. Let's start with the color most people expect to see, bright red. Bright red blood usually appears during the heaviest days of your period. It means the blood is fresh and leaving your body quickly, so it hasn't had enough time to oxidize. You may also notice a few small blood clots during these heavier days. Don't panic. Small clots are completely normal because menstrual blood naturally coagulates before leaving the uterus. However, if you're passing very large clots repeatedly, especially along with extremely heavy bleeding, it's worth speaking to your healthcare provider. But here's something important. Bright red doesn't always mean everything is normal. If you're bleeding between periods, after sex, or after menopause, you should always get it checked, regardless of the color. Now, what about dark red blood? This color usually appears at the beginning or the end of your period, or after you've been lying down for several hours, like overnight. Since the blood has remained inside your body a little longer, it begins to oxidize, giving it a darker appearance. Dark red blood is usually completely normal and simply tells you that your menstrual flow is moving a little more slowly than bright red blood. Brown blood, nothing to panic about. As the blood gets older, it often turns brown. Brown blood is one of the most common things people notice, especially at the very beginning or end of their period. Many women also notice brown blood first thing in the morning. That's because while you're sleeping, blood can collect inside the vagina before flowing out when you stand up. So seeing brown blood usually isn't a sign that something is wrong. It's simply older blood finally leaving your body. Black blood, the color that scares everyone. Although it may look alarming, black blood is usually just the oldest menstrual blood leaving your body. Because it stayed inside longer, it became heavily oxidized and turned very dark. Sometimes you may also notice thick, jelly-like clumps. These are usually blood clots mixed with pieces of the uterine lining called the endometrium, which naturally sheds during your period. You'll most commonly notice black blood at the very beginning or very end of your cycle when the flow is slowest. However, if you're pregnant and notice persistent black or brown bleeding, especially if it's accompanied by pain or heavy bleeding, you should contact your healthcare provider promptly, as pregnancy-related bleeding should always be evaluated. And here's another myth we should clear up. Black blood does not mean your vagina is blocked. A true blockage would usually stop menstrual blood from coming out properly and often cause severe pain, not simply darker blood. Next is pink blood. Pink blood usually happens when menstrual blood mixes with your normal cervical fluid or vaginal discharge, making the color appear lighter. This commonly occurs at the beginning or end of your period when the bleeding is very light. Most of the time, it's completely harmless. However, if your periods remain consistently pink over several cycles or become much lighter than usual, it could sometimes be associated with low estrogen levels, anemia, or in some cases, early pregnancy spotting. If you're unsure, it's always worth discussing it with your healthcare provider. Orange blood, don't ignore it. Here's a color that deserves a little more attention. Orange blood isn't actually a normal color for menstrual blood itself. It usually appears when blood mixes with cervical mucus or abnormal vaginal discharge. Sometimes this mixture is harmless, but if orange discharge is accompanied by a strong or unpleasant smell, itching, burning, pelvic pain, or fever, it could indicate an infection such as bacterial vaginosis or trichomoniasis. If that happens, it's important to see a healthcare provider for proper diagnosis and treatment. Gray discharge, the one color you should never ignore. Unlike the other colors we've discussed, gray discharge is never considered normal. It may be a sign of an infection, particularly bacterial vaginosis. In some situations, especially during pregnancy, gray tissue or discharge can also indicate a serious problem that requires urgent medical evaluation. When should you see a doctor? Here's something many people don't realize. When it comes to your period, the color is often less important than the symptoms that come with it. You should seek medical advice if you experience heavy bleeding that lasts longer than 7 days, bleeding between periods, bleeding after sex, bleeding after menopause, passing very large blood clots repeatedly, severe pelvic pain, fever or chills, foul-smelling discharge, persistent itching or burning, feeling extremely tired, weak, dizzy, or short of breath due to heavy blood loss. These symptoms deserve medical attention regardless of the color of your period blood. Your period is more than just a monthly cycle. It's one of the ways your body communicates with you. Most changes in color are simply the result of how quickly or slowly the blood leaves your body. So here's an easy way to remember it. Bright red usually means fresh blood. Dark red means slightly older blood. Brown and black usually mean older oxidized blood. Pink is often blood mixed with cervical fluid. Orange may indicate an infection if it's accompanied by other symptoms. And gray should always be checked by a healthcare professional. If you found this video helpful, don't forget to like, subscribe to Dr. How, and share this video with someone who might benefit from it.